Hello, my name is Nikita Mehandru, and today I will discuss joint work with Samantha Robertson and Niloufar Salehi, a machine translation deployment in medical settings. I'll walk through the motivation, results, and discussion sections of our paper. I'm going to talk about how cross-language communication happens in clinical settings and the role that machine translation plays. I'll start with a short story to illustrate the kinds of issues I'll be talking about. As part of this research, I spoke to a physician who had a patient who had just undergone a cesarean section and was struggling to put words to her pain in her native Taiwanese. The physician making rounds at this county hospital speaks English as her first language and decides to call an interpreter by phone, but the call isn't going through. Navigating such a language barrier is a regular occurrence clinicians face. With this story, I wanted to more broadly illustrate that delivering quality healthcare requires strong patient-clinician communication, which can be challenging in the presence of language barriers. Patients with limited English proficiency in the United States are more likely to face higher mortality and readmission rates. As a result, machine translation is often used by clinicians in the US as a low-cost and efficient way to communicate with patients, but the reliability and the accuracy varies. Our primary motivation for this work was to better understand how clinicians currently navigate language barriers, including when and why they use machine translation, if at all, what concerns they have about using such systems, and how they assess the quality of translations, whether by working with a medical interpreter or using a machine translation tool. We conducted 20 in-depth interviews with clinicians, including physicians, surgeons, nurses, and midwives in the United States across 7 medical specialties to better understand if and how they are using machine translation tools in medical settings. There were 2 main findings of our interview study. One was around communication challenges that clinicians face, and the second was around strategies that clinicians employ to overcome these communication challenges. In terms of our first finding, we found that clinicians faced communication challenges stemming from lack of time and resources, medical literacy, cultural barriers, and accountability and accuracy. In response to communication challenges, we found that clinicians used 4 main tactics to confirm the reliability of the communication between them and their patients. 1, rephrasing and simplifying medical terms. 2, back translation. 3, nonverbal communication, including gestures and drawings. And 4, testing patient understanding using social cues and teach-back methods. Our interview study with clinicians provided insight into how to design appropriate machine translation systems for medical settings. Cross-lingual communication between clinicians and patients can greatly affect the quality of care a patient receives. And machine translation systems are a low-cost solution that can address challenges clinicians have when interacting with patients in the presence of language barriers. Ultimately, we recommend that machine translation systems, 1, account for dialect differences. 2, combine neural machine translation with professionally translated medical phrases. 3, move beyond one-to-one translations by varying proficiency levels. 4, encourage a feedback system to check for understanding. 5, consider literacy levels of patients. And 6, set transparent safety standards and interactive suggestions for clinicians. We discuss how and when machine translation systems should be deployed in high-stake medical settings in our paper. And ultimately, we hope that this will help better serve diverse patient populations. Thank you.